Hey guys, first of all, thank you for being here. Today I'm going to be talking about the 10 top negative health risks of working night shift. For those of you that don't know me, my name is Jason Rozinka, and I have been a nurse for over 20 years now. It goes fast, trust me. The last 18 years I worked in the surgical ICU. 2 years before that I worked in a med-surg floor, and I worked day nights on the med-surg floor, 8-hour shifts. The ICU I worked 12-hour shifts, day night. And now currently the last year I've been working interventional radiology, straight day shifts. So I've seen a little bit of all shifts working as a nurse in a hospital. With that, most of you guys, when you start as a nurse, you're going to be starting as working day-night shift. Some of you move on and work day evenings, you kind of upgrade, or you go to a clinic job and work day shift. But today I'm going to be talking about strictly night shift and shift work, bouncing back and forth. It definitely takes time for you guys to adjust to this. And trust me, as you get older, the effects of working night shifts add up. I've known that now that I'm 43 years old and been doing night shifts most of my life. It's caught up to me, and now that I'm working day shift, things have changed since then. So here are my top 10 most negative effects of working night shift, and some of these are by experience and some of these by some research I did too. So one of them is diabetes, and there's research has said that there are increased risks for nurses working night shift, or anybody working night shift, for diabetes. Another big one too is obesity. If you look around at nurses in general, the obesity rate is 54% in nurses. And we're in the healthcare profession. We're trying to show a healthy lifestyle and teach our patients to do the same. And 54% of us are obese. If you don't believe that, you can just kind of look around tomorrow at work, look at your coworkers, and it's fairly obvious that nurses need help also. They're at increased risk for breast cancer. That's another risk for working night shift. Your sugar and insulin levels are off, and that is due to leptin. When you sleep, your body produces leptin, and that helps regulate your weight with your sugar and insulin levels. So less sleep, less leptin, more weight gain. Increased risk there's cardiovascular disease. So MIs, increased risk of stroke, increased risk of hypertension, increased risk of back injuries or any kind of injuries during when you're working night shifts. You're more tired, you're more apt to injure yourself, and really when you're working as a nurse on night shift, there's less help. So you're lifting heavier patients, the patients are getting bigger, and we're required to do more work with less staff, so there's more chance for injury. Increased risk of depression, definitely moodiness. I can adapt to this one, that when you're working night shift, you're getting less sleep, and you get more frustrated with your family who doesn't work night shift, and you're trying to sleep during the day and they're making noise. Your neighbor who's out mowing the lawn, it kind of wears on you, and when you're trying to get sleep and they don't understand what it's like to work night shift, you get moody and crabby for sure. Any GI issues are related to night shift also, peptic ulcers, GERD, and just increased risk in cancer in general. So these are just some of the risks that you have for working night shift. Not trying to scare you out of working night shift, but they're there. It's been researched, and that's just the way it is with working night shift. It takes a toll on your body, and hopefully this helped you kind of identify the negative risks. In another video, I'm going to chat about different ways to help you out working night shifts, to help not make these as apparent in your life or when you're working night shift, with a few tips like that too. So hopefully this helped you out, guys, just telling you the negative effects of working night shifts. If you like this video, make sure to comment and share, and we'll see you in the next video. Take care. Peace.